Hello everyone, this is Dr. Mike Chua, Certified Dementia Practitioner, and today we'll talk about the different types of vital signs. We've got four vital signs. First is the blood pressure. Second is your breathing or your respiration. Third is your temperature. And fourth is your what you call heart rate. So first we'll talk about the blood pressure. So most of the time when you go to the nursing home or nurse comes to your place or you go to your doctor's appointment, they use this. It's called a sphygmomanometer, and they put this on your arm, and they also listen to your heartbeat using a stethoscope. And if you do it yourself, it's going to be very difficult. You're going to be putting it and wrapping it around your arm, and it's very difficult. Actually, I have a hard time doing it myself. So I would just recommend that you guys use a device like this, like a wrist blood pressure machine, and it's very convenient. A lot of people or nurses or even doctors would tell you it's not reliable, but for dementia patients, I think this will be much better, because if you can teach your loved ones how to use this and use it properly, put it on their wrist, and let them do it on their own, they could actually learn how to check their blood pressure first thing in the morning. There are a lot of causes of falling, and one of the many causes is what you call orthostatic hypotension, where the blood pressure goes down very quickly when you stand up. So you as a primary caregiver needs to really check the blood pressure of your loved ones. So making sure that the blood pressure doesn't go down very quickly. So let me finish up with this one. Check my blood pressure if I'm hypertensive or not. I'm normally hypertensive. And here you go. I am hypertensive today. I'm running 140 over 100, and my heart rate's pretty high too, so I'm kind of hyper right now. Second, Second vital signs that you need to check for your loved ones is the breathing. Making sure they're breathing. The normal is between 13 to 18 breaths per minute or cycles per minute. So just make sure you're just checking them. That they're still breathing. And of course, you also want to check their oxygen. You might want to buy this one too. It's called the pulse oximeter. It's very quick. It's a very small device. You can actually put it around your neck. I bought my dad and some of my patients. It's a very cheap one, 20, 30 bucks of an investment in knowing what oxygen level you have for your patients or your loved ones. Right now I'm running 98% and my heart rate running at 100 beats per minute because I'm kind of hyper right now. But yeah, you guys need to buy this too. It's very inexpensive device for you to know the oxygen level of your loved ones. Sometimes when their oxygen level is low, like less than 90, around 88, 85, a lot of people will pass out. So just make sure you get this too. Third is what you call your temperature. When you want to check the temperature of your loved ones. A lot of people would buy those thermal or auxiliary thermometers. I would buy this. It's very convenient. It's non-invasive. You don't put something in the mouth of your patients, and you just put it on the forehead, and boom, you got the temperature. Because a lot of fever or UTI, you don't know what's going on. At least you got them real quick. Kind of normal right now, 98 degrees Fahrenheit. The normal is between 96.8 to 99, so that's normal there. And then the last vital signs is your heart rate. You also want to check the heart rate of your loved ones. You can either check them here on your what do you call that artery here, radial artery. You can check them in here on your carotid artery, but you don't want to check here. It's so hard. So you can use this too to check their heart rate. Just put it in that finger there, and boom, you get the heart rate. There you go. You got the heart rate instantly. Or on this device here, you can check the heart rate. Or if you're fancy enough, you can, if you got a fancy phone, it checks the heart rate too. Or you got those special wristwatch, smart watches, you can use that too. So again, those are the vital signs that you can use for your loved ones. I'm gonna put a link on all the products that I've mentioned. The BP cuff, I found some more affordable ones. The thermometers and also the pulse oximeter. It's very vital that you get the vital signs of your loved ones. Okay, again, Good luck. Always remember, vital signs are vital in taking care of your loved ones. Again, thank you very much. I love you, and God bless you. Bye bye.